The government of St. Kitts and Nevis and the opposition People's Labour Party (PLP) have been arguing on their performance in health care. The PLP argues that the government is not paying enough attention to health care and is calling for focus to be paid now on the JNF General Hospital. Chairperson of the PLP and former Health Minister Wendy Phipps gave these sentiments at the PLP press conference earlier this week.
By the time we would have left office, the amount budgeted on health care, I think it had peaked at somewhere in the region of about 60 million plus per fiscal year. When we took office in 2015, that figure was dancing somewhere around 40 million. That's where it capped at, okay? So that gives you an idea of the type of continuous investment that is warranted. So what we also recognized, however, is that when we took office in 2015 as a team unity government, the prior administration had abandoned the phase 3 of the JNF Hospital. And that phase 3 would have included all of your back office functions like renovation to the morgue, the kitchen, a cafeteria for the staff, daycare center to assist workers at the hospital who had young children to look after, central medical stores, etc., a rebuild of the psychiatric wing, which is far overcrowded now, and so forth. But however, it seems as if what this new government was more concerned about, and perhaps still is concerned about, is the rebuilding or the building of what they consider to be a smart hospital. Well, by any stretch of the imagination, whether you're building an ordinary hospital or a smart hospital, it cannot be built overnight. Those types of large infrastructure, public projects could run into years in order to be done properly. But nevertheless, we would admonish the government to focus on dealing with what we have now in terms of JNF so that it meets the needs of the public.
But Prime Minister Dr. Terence Drew, who is also the Minister of Health, suggested at his roundtable with the media days later that the government is making inroads in improving healthcare at JNF.
We have brought in very up-to-date anesthesiology machine. The other day, one of the machines, I think, went down. And there was some talk about anesthesiology. The machines will go down all the time. What was never compromised was our ability to do emergency surgeries. You here have these cameras, they can go down, your watch can go down. But we have backup. And not only that, we made sure that if the worst case scenario happens, we can still do emergency surgeries. All these things we are doing at the hospital, we're going to reopen the private ward. The most dialysis machines we have ever had in St. Kitts and Nevis, we can rotate them in and out. We fixed the water problem at the hospital to a great extent. Change out the toilets at the hospital. We have now introduced the most specialists the hospital has ever had at any one time in its history. We have neurology, never had that before. That's doctors who deal with nerves and brain and strokes and so forth. A stroke is a problem. We have 4 internists, the most we ever had. We have 4 government-hired internists, plus a private one, the most we have ever had at any one time. Today, I got to note that the ICU is empty, and people are thinking that the ICU is empty because you have such improved care in terms of the specialists at the internal medicine level. The patients are not reaching to ICU. They said they have never seen, they said it's been a long time that they have seen no patients in ICU because of the improved care at the lower level.
The Prime Minister noted that plans are moving apace for the construction of a smart hospital on St. Kitts. I'm Andre Huey for SKN Newsline.